we need to see a lot more for reasons that we're going to get into here in a minute. As of yesterday, there have been 31,521 cases and 805 deaths reported. COVID has not gone away. We're averaging 49 new cases a day, every day, and positivity rate is 1.6%. I'm going to take off my mask now so that I'm less muffled for the mic and so that those who read lips are better able to follow along. The Delta variant and the Delta Plus variant are here in Louisiana. It is real and it is very frightening. This is a moment of sobriety and a moment to take stock of where we are. We don't want to take our eye off the ball. We don't want to declare victory prematurely. And above all, we do not want to go backwards. The Delta variant we know is here in Louisiana. It is more transmissible and in many cases more dangerous than the basic COVID variation. Dr. Avegno is going to go more into that into more detail here in just a minute. But the things to be aware of, with Delta out there, if you're unvaccinated, there are two things that can happen. You can get it and you can die, or you can get it and you can spread it. And when you spread it, the more it spreads, the more opportunity it has to mutate. The more opportunity the Delta variant has to mutate, the greater the danger of it mutating to a point where it could potentially become vaccine resistant. At that point, we're all back to square one. So the message, the core message here is get your shot. Get vaccinated. It is absolutely critical. Everything is dependent upon that. The potential economic impact, the social impact, all the progress that we've made climbing out of this pandemic, climbing out of the devastation that it created for our local economy and for our city and our residents. We stand to lose that if we go backwards. We absolutely don't want to have that happen, but the way that that doesn't happen is through vaccination. I'm now going to turn it over to Dr. Avegno.
Thanks, Beau. Appreciate you having me here today. You presented the numbers quite well, I have to say. Thank you. Yes, 68.3% of adult New Orleanians 18 and over have received at least one dose of vaccine. More than half of all of our residents, those eligible and those young kids not eligible, are fully vaccinated. And the great news is that these numbers exceed the U.S. averages, and they're higher than many, many other urban areas and cities across the country. So overall, in New Orleans, we have a good level of protection against COVID, and we're close to getting to that 70 to 80% target of the population that public health experts think we need. We do still have segments of our community where vaccination rates lag. Certain neighborhoods in New Orleans have far less than a 70% adult coverage. The gaps are closing. It's just going to take some time. Our older residents, 60 and above, have outstanding protection at right about 80% first dose vaccination. That's tremendous. But our 18 to 39-year-olds are only more than half protected. So there's a big gap in terms of age. While New Orleans leads the state in our vaccination rates, many parishes are nowhere near our level of protection. In fact, if you look at the parishes across Louisiana, half are only at 1/3 of the population or less having one dose. That is not a very good level of coverage. So it should not be surprising then that we're seeing the Delta variant spread widely throughout Louisiana and encroach into New Orleans. This is the virus mutation that was first noted in India during their incredibly deadly spring surge. It's now the dominant strain in Louisiana and in the U.S. It is significantly more contagious, and it likely causes severe disease as well. With a large number of the population unvaccinated in Louisiana, it is spreading easily and rapidly, causing average daily cases statewide to more than double in 2 weeks, and hospitalizations to rise sharply in that same time period across the state. While the increase in cases has not been as steep in New Orleans, again, we have higher vaccination rates, we are seeing numbers now, as Beau mentioned, our average 7-day numbers are as high as they were in March. So that sort of wipes out the progress that we've been in the past 4 months. It's not just confined to Louisiana. I really want everybody to encourage everybody to look at what's happening in Mississippi, a state that has the lowest vaccination rate in the country. They are seeing tremendous increases in hospitalizations and in cases for the same reasons that we're worried about today. The good news for us and for those of us who are vaccinated is that all available vaccines have strong protection against Delta and other known strains of the coronavirus that are circulating right now. LDH, and we are tracking breakthrough cases as best we can in fully vaccinated people. And we expect breakthrough cases because we know as good as the vaccine is, it's not 100%. But as much as we expect them, they illustrate the point that if large numbers of unvaccinated individuals continue to put themselves and others at risk, the chance of a vaccinated person getting sick increases as well. In Louisiana, 99% of the deaths since mid-January, since vaccines started to become available, are to unvaccinated people. Only 1% are of vaccinated people. If that is not a strong reason to get vaccinated, I really don't know what that is, and that's undeniable evidence that COVID is now a preventable disease. Even when we look at those severe breakthrough cases, the cases that are either hospitalized or died, even though they're a small percentage, the median age of people who are getting a severe breakthrough case is in the 70s. So again, our most at risk overall from COVID are still at risk if we continue to have low vaccination rates. If the virus continues to have a susceptible population in which to spread, it will inevitably, as all viruses do, mutate to a strain that is much more resistant to vaccine. And as Beau said, we're back at square one at that point. So again, it's a race against time. In New Orleans, our hospitals are not seeing the numbers of COVID patients specifically that we did during the winter surge, and that's a good thing. But they face other critical challenges. Nursing shortages statewide are real, and they mean that once again, patients are often transferred to our regional hospitals for specialty care from hours and hours away in Louisiana and Mississippi as well, while we are also grappling with a diminished nursing workforce. So there are bed shortages because of workforce shortages. This translates into another hit to our public safety system in that EMS units are starting to see really high wall times because there is not a staffed bed and oftentimes to put a patient in. So all of this affects us. What's new is that pediatric admissions are up significantly, again, both locally, and we're seeing this across the country. As kids are now out of school, not wearing masks, they're interacting in a way they really haven't done for 16 months. So they're spreading childhood infections like RSV and GI bugs and that sort of thing that usually get stretched out across a longer fall-winter season. We're seeing them now in a time when we don't see them, on top of COVID that is circulating in many pediatric settings. So all this creates a bed crunch. We have seen this movie before. Hospital beds are full, exhausted healthcare workers with limited options, and a strain on the entire system. You know, I have to always thank our residents for being so patient, which maybe isn't something we always associate with New Orleanians, but certainly resilience is, and strength over the last many, many months. It is because of our residents that we have come out of the worst, I think, much, much better than other places, and certainly much better than was predicted in our very, very dark early days. But we are not done yet. If we truly want a better back to normal, if you are not vaccinated, please talk to a trusted provider, a friend, a family member about why they got vaccinated and why they think you should be. Think of them. Think of the high-risk people in your life. Think of the kids under 12 who are not yet protected in your life. Until you get vaccinated, please wear a mask and avoid interactions with individuals at high risk. When you are ready to get vaccinated, there's still lots of places you can do it. You can find community vaccination sites at ready.nola.gov. There's a community vaccine calendar. The major hospitals all have clinics that you can walk in or make an appointment to. If you are older, if you have a high risk of complications, if you have immune deficiencies, or if you live with someone who is, I urge you to really think about continuing to mask indoors, whether you're vaccinated or not, in places that are public and you don't know the vaccination status of everybody who's there. As long as Delta is causing outbreaks all around us, we've got to protect our most vulnerable, as we have for the last 16 plus months. So this is why you're going to see me continuing to wear a mask in public. Everybody knows I've been vaccinated. I did it on TV. But it's for my mom, who is fully vaccinated but older and has health challenges. For me, it's a small price to pay wearing my mask when I go to the grocery store or church or wherever it is that I am, knowing that I'm cutting down on a small risk of being that breakthrough case that could land her in the hospital or worse. So we have come far, but it would be unthinkable to go back now. Nobody wants to go back. And so we all really need to keep pushing, get vaccinated, and protect those that we love. And that's it, Bo, if you want to take questions.
One second, but before we move on, I just wanted to close out on this really quickly. The message is that Delta is here, Delta is dangerous, and Delta is killing people. This should scare the hell out of you. The message from the mayor is that this is very serious, and you need to get your shot. We can't be more clear or more stark than that. And now we will take some questions for Dr. Avegno.
Dr. Avegno, considering that we're at that 1.6% now, which we haven't been at since March, you said, and we are certainly not doing the amount of testing we were doing back then, do you suspect that the numbers are actually higher than the 1.6%?
Well, the good news is we're still doing a lot of testing. We might not be doing 7,000 tests a day, but we're doing more than enough that we need to have a good sense. Tests are pretty widely available at urgent cares and clinics and, pop-ups here and there. So I do think we have a good sense. I think that 1.6% is going to be up tomorrow. Just what I'm seeing on our daily percent positivity, I think it's going to be up. It has been trending up statewide over the last 2 weeks and even in Region 1, which includes us. So I think it's a real picture of where we are. Okay.
Dr. Avegno, everyone's looking forward to this fall. There are a lot of festivals. We're, hoping to have Saints games that potentially could be at full capacity. When you look ahead to where we are right now, the fall's not that far away. What are your concerns, and do you think that we might potentially see some changes to what people are expecting right now?
Yeah, so what we have in place right now, as you probably know, is that for any large event, which would be a festival, which would be a game, anything like that, that wants to have 100% capacity. There's two paths to get there. The first path is everybody has to wear a mask. Why? Because we know masks work. The second path is you could ask for proof of vaccination or a negative test, right? So if you don't want to go the mask route, that's the other option. Both of those are reasonable mitigation measures. Certainly outdoor events are going to be safer, but it applies to that as well. I think folks should expect that might be the case in the fall. We would all love to have large events that did not require some degree of mitigation. And before Delta, I was maybe a little more confident that we would get there. We really need to see what happens with Delta and what happens with the folks, not just New Orleanians, certainly we want to protect ourselves, but with the folks that are coming in to our events and where they're coming from and what they're bringing with them. I think we're obviously watching that very closely.
Any other questions for Dr. Avegno? The advocate? What would be your message to parents who have those kids who are under 12 who aren't vaccinated, who are interacting with other children who are under 12 but not vaccinated?
Yeah, that's a really great question, and it is tough for families. We know that the vaccine is likely to get approved for younger kids as young as 5, hopefully in the next 2 months, probably not exactly for back to school, but close. But I would ask those parents to really think about acting as if it's an older person in their house, right? Because their kids are certainly vulnerable, and we are seeing outbreaks in summer camps and daycares. Kids generally are going to have an easier course of COVID, but that's not 100%, right? So parents need to, in other settings, parents need to probably mask up indoors and certainly think about who their kids are interacting with outside of their family, outside of summer camp. Are they going to see grandma, right? Is grandma high risk? Maybe grandma should be wearing a mask when interacting with that kid that's just been at summer camp. Most of our camps and daycares still do have good mitigation measures. They're wearing masks to some degree. They're keeping kids cohorted, and I think that will help. But I think that parents certainly don't want to run the risk of transmitting to others that may be at high risk, so they should take more precautions.
Okay. Dr. Avegno, this is not COVID-related. This is more about the homeless encampment situation thing that's going on. We've been getting complaints from the residents into May about inflated underpants, those encampments beneath there. And what is the city's plan to deal with that? I think the primary argument they make is that this is an issue that was a downtown issue prior to maybe the last 8 months or so. And with a lot of downtown being fenced off, these folks moving more into the neighborhoods. And the issues that come with that, the drug use, the behaviors or whatever, if they need to play one over fast. Is there a plan to deal with that? Or is it one of those things that, you know, hey, homelessness is a deal and we know it's a part of our society?
Yeah, so the health department's role in homelessness is connecting residents to services, people like Unity and social service agencies, and cleaning those encampments that pop up, move, change, to prevent acute public health hazards. So COVID outbreaks, Hep A outbreaks, typhus like you've seen in other parts of the country, and to, you know, make what is not a great place to be safer in terms of acute hazards. It takes a multidisciplinary, multi-departmental, multi-agency team to address the overall complex problem of homelessness. And the first reason for homelessness is not having enough affordable housing. Having done encampment cleaning since pre-COVID, they actually have been all over the city. Certainly in New Orleans, they have tended to concentrate near downtown, similar to other cities, because that's where a lot of the services are, and so it makes sense, or the hospitals or whatever. But they always have popped up in neighborhoods. It's just that when it's your neighborhood, it seems like it's the first time. So again, our role is really to identify acute health needs, clean, prevent outbreaks, but then be the bridge and be sort of a trusted face of the city to get service providers in. As you've probably heard, our low barrier shelter, which has been successful in that, has been full since it opened several years ago, is expanding with another 200 beds that I'm not sure of the timeline. I know it's hoping to be in the next few months to be open. Ozanam Inn is renovating their building. There's going to be more capacity, but really absent significant affordable housing, like many other cities, it's still going to be a challenge.
What about COVID and the homeless?
Good question. Yeah, we have been doing vaccinations, and we meaning the city as well as several partners for months now. So we've gone under the bridge, we've gone to Duncan Plaza, we've gone to shelters, library, where, you know, often you can find homeless people, and have been giving vaccine for months now. I think everybody that wanted a vaccine has had opportunity, and I know some of our partners continue to go and offer vaccines. Fortunately, we have not seen significant outbreaks in shelters in the recent couple of months, as far as I'm aware of. And even throughout COVID, had some outbreaks here and there, but not sort of consistently. So, you know, I do think we've gotten some folks vaccinated, the ones that wanted to be, and that's probably protecting that sheltered environment.
What is the current strategy, I guess, of the health department in terms of boosting those vaccine numbers and trying to get to herd immunity?
Yeah, it's really a community-wide effort. We are pleased to be in the fight with our major healthcare systems, several of our FQHCs, the schools, and the community partners. We meet regularly. In fact, we met this morning to continue to identify those areas of the city that have low vaccine uptake and divide and conquer, right? So we work with community partners to say, okay, is there a church? Is there a store? Is there a school that we can park outside? What is the place in this particular census tract where we can go? Okay, who's going there, right? Crescent Care, where are you going? Ochsner, LCMC, where are you going? How can we support? We've done that since the pandemic. The numbers are smaller, right? We're not getting 100 people to show up, but if we get 20 or 25, then that's really a win. We're hopeful with back to school coming up. A lot of our partners, we're trying to split up the back to school events, you know, backpack giveaways or places where 12 and up and their parents are coming. We know that when kids get vaccinated, sometimes they bring a parent along to get vaccinated too. Maybe they sort of push them to that. I'll say that the schools coming out with their plan, which I think is a solid plan, that if you're vaccinated, you do not have to wear a mask. I think that's going to encourage some kids and hopefully some staff as well who are kind of on the fence to do it. So we're here to support them with that too.
Other questions for Dr. Avegno?
Thank you very much, Doctor. Sure. All right, so we've covered Delta at this point. I've got a couple announcements I'm going to run through, and then we will take some questions. Just a second to get the notes sorted out here. So real quickly on the Plaza Tower, quick update on that. The netting is up. There were some delays due to rain and wind over the weekend. We do anticipate opening the streets around Plaza Tower later this week. We don't have a set date yet, but what I'm saying this week, I'm saying probably by Friday. We'd certainly like that to be sooner. When we have more specific information on that, we'll put that out. Also, get this on everybody's radar. Chief Ferguson is going to be out tomorrow at 1 o'clock at NOPD headquarters to hold a press conference, giving an update on their results and the work that they have to show. I think that's it for my announcements, and now we can take some questions.
Any questions? Dan?
In regard to the ongoing trash situation, what's the administration's response to barrier process disposal events to wait the ongoing sanitation?
Yeah, so to be clear, the mayor is opposed to that. By our estimation, that could cost us about $3 million at a time when we really can't afford to do that. And more significantly, it doesn't solve the problem. While we're very aware of the difficulties that people have had around trash collection, we're sympathetic to it, and we're working very hard with the ownership to hold them accountable and to get those collections happening. You're seeing that progress right now. It's getting better. It's not perfect yet, but we anticipate them getting back completely on track by the end of the month, if not sooner. But as it relates to the council member's suggestion, that is not something that we can support because if for no other reason, we don't think we can afford the $3 million hit that it would entail.
How would that happen? How would that
That would be the cost once we took out all the $24 per everybody, right? Cumulatively, that rolls up.
But does that money go, so, you pay your $24
Sure.
fee, does that any of that go to the city's general fund?
I'm
That's what I'm asking.
sure. Let me circle back with you on that because I'm not completely clear on the mechanics of it, and I want to make sure I give you a correct answer on it.
In terms of contract with Metro, there is the option of flying them.
Potentially, yes, right. And that's a conversation that, it's an open conversation. That could still happen, right? That's not our first option. That's not our first choice. Right now, we are trying to work with them because there is a labor shortage. That's what they're dealing with. It's a nationwide problem. They're taking steps to address it. Certainly, our staff and the administration have been working very closely with them to get it working again, to get it back up on its feet. That's the priority, is to get the collections happening, get them back on track, and then we can sort of look at potential penalty or any other kind of concern as a secondary issue.
The issue?
We've heard from a business who says they're having trouble getting music permits in the city. Do you know if this is a larger issue or just something that seems to be,
It's not a larger issue. Are you talking about zoning MASH? Okay, so I'm glad you asked. I had this down before I came out. There were, as I understand it, we spoke with code enforcement about this today because there was a story last night with the Gambit. I know a couple folks have followed up. There are several issues that were cited by code enforcement. Code enforcement did meet with them and with District B and went through their issues. Our understanding is that they have applied for the necessary permits and have filed their plans to finalize the conditional use. But basically, relative to what their initial permit was and the way that they are operating, I think there were some hours issues. There were some issues with charging cover that weren't covered in their initial application. They were just out of sync with what they had applied for. So they did pull the permit, but they're working with them to get it stood back up. It's not a widespread issue. It's specific to that venue, and we anticipate being able to get that resolved and get them reopened pretty soon. Okay?
LBJ?
Well, to circle back on the trash issue.
Yeah.
Are the other contractors continuing to work with Metro on the pickups? I know last week we had a Sydney's company.
Yes.
and all of
Yeah,
that.
short answer, yes. As I understand it, up through this week, as recently as today, there are other contractors that are working with Metro to help them get caught up.
And is there anything latest in that that's moving the ball forward besides the, hey, it's a labor shortage, we know it's a national problem, or anything like that? Is the city doing anything else to try to?
Well, again, we're working with the contractor, and I believe Metro is actively working to hire and solve their labor problem, right? And that means money, that means conditions, that means everything else. They're working so that this is not a long-term thing, right? Once they get this solved, once they're back on track, we're confident that they're going to be able to deliver the service that we expect.
And Mr. Wood says that he would think that they'd be back on track by the end of July. Is that still the timetable you're looking at?
That's still what we're operating under, yes. I believe last week he said 2 weeks, And we're thinking the end of July, which about syncs up to next week. Okay?
WWL.
Back to the trash again.
Back to the trash. I'm getting hot, Danny.
If the council does pass it on Thursday, would the mayor eventually veto it?
I don't know that we're there yet. I think there's conversations that still need to be had with the council. And once that they sort that out, ask me again on Thursday. I'll put it like that. Okay?
One more on the trash, and I swear this is it though. The other council person, Cindy Wynn, was proposing the 1 day a week pickup.
Mhm.
And her point being, well, I certainly can't speak for her.
Sure.
But essentially, if people knew that this is going to be the day it's going to be picked up, you put your trash out there as opposed to it sitting on the curb for an entire week.
Mhm.
Is that something the city willing to back?
Potentially, without seeing the specifics of council members' proposal, I couldn't answer it comprehensively, but potentially that's certainly something we could look at. I don't know that it's necessarily our first choice, but we appreciate that the council's leaning forward on this and is attempting to offer solutions and alternatives, and we want to work with them on that.
Anyone else?
Don't say trash, Danny.
Not trash.
Okay.
Old favorite, Hard Rock. In terms of Rampart Street, where that's proposed, any timeline on when that will be reopened?
Not as yet. As soon as we get some more details, I'll let you know. I know that, I think you had emailed about that this morning. Don't have specifics on it, but again, as I often say, we want it to happen sooner rather than later. Okay? All right. Thanks a lot, everybody. Appreciate your time.